Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, welcome to a new topic today. In this topic, let us now learn about first thing about history of anesthesia. So, where is the word anesthesia derived from? The word anesthesia is derived from Oliver Wendell Holmes. Oliver Wendell Holmes described the word anesthesia. Then, in 1844, Horrell Wells. So, Oliver Wendell Holmes describes the word anesthesia. In 1884, the scientist Horrell Wells discovered an aesthetic property of N2O, but he failed to demonstrate the property. In 17th century, if you see, there is a scientist called as Joseph Priestley, and this Joseph Priestley has given, uh, if I mean, has discovered nitrous oxide, nitrogen, nitrous oxide and oxygen. Okay, in 1864, 16th October, this is 16th October is called as World Anesthesia Day. Why? Because this is that day when the first anesthetic drug has been used. That is, it is by W.T.G. Moran, is a scientist who has discovered or demonstrated first ether has anesthesia. Okay, and he is called as father of anesthesia. Father of anesthesia by W.T.G. Moran, who has described ether as the anesthesia. Then in 1847, we have the other scientist, other doctor, who is J.J. Simpson. J.J. Simpson has introduced chloroform by J.J. Simpson. Then we have Dr. Snow. Dr. Snow is the first practicing anesthetist. Among all these, the first practicing anesthetist is J.J. Snow. Then in 1878, the first elective intubation or by blind oral intubation was done by McEwan. McEwan that has done the first elective intubation or first blind oral intubation. First blind nasal intubation was done by Ivan Magel. Ivan Magel has done the first blind nasal intubation. First blind oral intubation by McEwan, and that is the first elective intubation, whereas first blind nasal intubation is by Ivan Magel. Then Goodell. Goodell first introduced cuff in endotracheal tube. In endotracheal tube, Goodell is the scientist, is the one who had first introduced cuff in the endotracheal tube. Then who has introduced laryngoscopy? So laryngoscopy is very important, especially because now, because of the if you see everything, laryngoscope is very important, especially for airway management. Okay, that is first introduced by Jackson, and this laryngoscope was modified by Magels, Miller and McIntosh, and we have different types of laryngoscope. And then we have
thank you and thank you for watching.